Greetings everyone, Dr. Melanie Crites here with 360 Pelvic Health Institute and the Center for Men's and Women's Urology, coming to you with a new segment from Portland, Oregon. And I want to talk to you today about a condition that is generally a result of surgical procedures on the pelvis or the urethra or even childbirth. Patients can commonly experience urinary retention or inability to evacuate the bladder of urine after some of these procedures. And I've seen a few patients in the office recently who have had this phenomenon. And this certainly can happen after things like motor vehicle accidents, after back surgeries, after big colon surgeries. And the question that I always get is this permanent? Well, the good and the bad. Sometimes it's permanent. Lots of times it's not. So it depends on what the cause is of the inability to empty the bladder. Things like childbirth or surgical procedures that cause trauma to the pelvis, generally that's a temporary sort of situation where in simplified terms, the nerves down there just become a little bit numb and a little bit stunned, and they need a little bit of time to recuperate. And then generally the bladder then retains its ability again to evacuate the bladder. Now, situations where this may not be a temporary sort of situation, that can be things like nerve damage. And nerve damage can commonly happen when there are big pelvic surgeries or when there's back surgery or even motor vehicle accidents. At any rate, if this lasts longer than a few months, basically there are two ways to get the bladder emptied. Either a catheter insertion, whether that is through the urethra or by suprapubic tube, or teaching the patient to catheterize themselves, called self-intermittent catheterization. And basically, that's where you insert a catheter a few times a day, and that allows the bladder to completely empty. Now, if it lasts longer than a few months, then generally what we recommend and what patients need is a study called urodynamics, or bladder function studies, to figure out if the bladder has lost its function permanently or if it's something that is obstructing the urethra, things like that. Either way, it's not something that you should stress over until about the 3-month mark. And then at that point in time, probably at that point in time is when I would suggest further evaluation and speaking to your physician about it. As I said, generally it's a temporary sort of situation, but again, there are those times when it's not. So doesn't mean it's not fixable. It just means that it needs to be further evaluated and the source determined to determine if it is something that is permanent or if it is something that is temporary. So again, talk to your doctor about this. I hope this helps. Please keep sending in your questions, because this has also been a common question that we've received. And as always, thanks for letting 360 Pelvic Health help restore your confidence.